Alrighty. So Mark's asked me to speak for about 20 minutes and I have my faithful little digital timer here ready to let me know. Make sure I don't. Actually, I will be talking a little bit about COVID, but I'm actually going to be talking about a whole lot of different research projects I've done for about over the past 8 years or so about how and why people use digital health technology. So it's sort of got a digital health focus in broad terms, but from a sociological perspective, given that I am a sociologist, but also a media and cultural studies person, I sort of try and bring all those perspectives to bear when I do my research on how and why people use digital health tech. And Mark also mentioned that both Kath and I are actually in the ARC Centre of Excellence, which I've got there. It's ARC Centre of Excellence for Automated Decision Making and Society. I'm a CI, Kath's an AI. I also lead, well, I'm the leader of the UNSW node of this Centre of Excellence. I also lead the health focus area. That's one of 4 focus areas we have in that Centre of Excellence. And I'm co-leader of the People program, where we do a lot of social and sociological, anthropological, ethnographic work on how people engage with emerging technologies. But I'm also in the Centre of Social Research in Health and the Social Policy Research Centre and run the Vitalities Lab. So I've got a lot of hats, but they all kind of brought to bear on the research that I'm going to be talking about today. So just as an overview, when we think about, the term smart is often used to describe digital health technologies. So I've got that word there, smart health technologies. And just so we can contextualize this talk within the sort of broader landscape of smart health technologies that currently exist in Australia or in other countries in the global north, less available in some lower income countries though, of course. So we have the kind of old school information websites and blogs, which are actually still used a lot and which are very popular actually still, even though they've been around for a long time, which give information about lots of health related issues and topics, of course. Then we have the social media platforms, Facebook being by far the most popular, most used in Australia and other countries in the global north, but also Twitter, Instagram, Snapchat, Tumblr and those kinds of platforms, where there's a lot of health talk going on, a lot of peer support, a lot of sharing and creating and sharing information, commentaries to and fro, weighing up information or misinformation happening on those platforms to do with health issues. Then we have content sharing platforms like YouTube, Pinterest and TikTok. Now for me, TikTok is particularly interesting because it's a youth-oriented platform. It's very, very popular and became first popular in Asia and China and India and still is incredibly popular there. But over the pandemic, it's become very, very popular in places like Australia. It's really burst out into the global north, and it is a site, actually, you might not think of it as a site if you're not familiar with it, for sharing health information, but it absolutely is. There is lots of discussions about sexual health, about COVID, about other infectious diseases. Pretty much any health issue you can think of you can find on TikTok. And of course, it's young people sharing that information, but it's also healthcare providers sharing that information on TikTok. Then there's patient support platforms like Patients Like Me, which was set up specifically for patients to communicate with each other and share information. Also, these days to sign up to clinical trials. Mobile apps, of course, hundreds of thousands of those related to health issues now available on the major app platforms, stores, and wearable devices such as fitness tracking bands and smart watches for people who want to monitor aspects of their health and fitness and activity. Digital self-care devices have been around for quite a while now too, for people with chronic health illnesses such as diabetes or high blood pressure issues to monitor their body functions and data at home as part of their self-care, and electronic health records, which has had a bit of a up and down experience in Australia with my health record, but we're still trying to get that sort of coordinated across the country so that information can be readily shared about people's health information. Online healthcare, and of course, telehealth and telepsychology also became very suddenly popular. A lot of red tape was cleared away in the first year of the pandemic, and they both of them proved very, very popular with people so that they could readily access healthcare in ways that many people otherwise couldn't, particularly those in rural and remote communities. Automated diagnosis has become a thing that healthcare providers have begun to experiment with. Aging in place technologies, very popular way of helping people stay at home as they get older. And also the whole sort of Internet of Things, which is a whole lot of, you know, so-called smart homes, furniture, cars, workplaces, wearables, digital home assistants, all working together to provide information, monitor people, and just make life easier for people. So that's the kind of context that I've been working in over the past 8 years, trying to sort of explore how people are using these technologies. I must admit I have very little research background in AMR related topics. So I actually did a bit of a quick and dirty look around yesterday and just sort of seeing what kind of digital tech I could use or what social media platforms are actually engaging with AMR related information, peer support, content, other content. And so the first thing I did was to use the Google Trends tool, which you can actually compare search terms and see over a period of time, you define what the period is, how often, what the relative frequency of searches is. And I was quite interested because it seems to me that antimicrobial resistance as a term probably isn't something that the general population is still not that familiar with. I'm guessing there, and you would all know better than I about that. But it was interesting to compare that as a search term with antibiotic resistance and with superbug, because they're terms that I'm actually, as a sort of member of the general population who doesn't do research on AMR, they're terms that I'm sort of more familiar with. And as you can see, antibiotic resistance is a term that has been used a lot more mostly than antimicrobial resistance. Superbug, it's popped up here and there as well. And this is actually a period from June the 1st, 2004 up till yesterday. And it's interesting that there was clearly a big interest, people searching Google for antibiotic resistance in those early years, and I'm sure Mark and others will know why. I don't. But there were clearly some interesting newsworthy issues around superbugs and other sorts of things happening around 2004, 2005, 2006. So that's a sort of quick and dirty way just to get an idea about what the general interest from the public might be in terms of what they're interested in finding online about AMR. I had a look at Facebook to see what was there in terms of groups or pages on AMR. This is the one, Antimicrobial Resistance Fighter Coalition, I found that seemed to have the most likes, membership. I had a look at just what could be found on major websites like WHO's website. Obviously, they provide lots of highly valued and expert information about AMR. So people will be able to find that pretty easily if they Googled AMR. YouTube. This was I've got a feeling the title of this video probably had something to do with how popular it is. It's very, very popular on YouTube. It's called The Antibiotic Apocalypse Explained. So that's clickbaity already. But it actually was a very good video. I found I had a look at it. It's very, provides information in quite a accessible way, but quite detailed biological information. And Twitter. There's a few Twitter accounts that seem to be sharing a lot of information. And TikTok, just to get to TikTok, I was wondering what was about microbes on TikTok. So AMR doesn't really get much traction on TikTok, but there's some interesting accounts by people explaining, microbiologists explaining all about the various bacteria and other pathogens and so on, and microorganisms one can find in in rainwater or toilet water or anything like that. And so yes, that was my quick and dirty look at how digital media are talking about AMR right now. So in terms of my approach, Mark mentioned earlier, critical digital health studies is what I call my approach. And that does involve challenging techno-utopianism and solutionism, terms that Mark used, and also identifying the social, cultural, political and ethical implications of digital health technology. So when I'm doing my research, that I've always got those kind of issues at the back of my mind. And I'm also thinking about the digital health cultures in which people are making sense of information about health issues or controversies. And these are how we think about ourselves and our bodies. Mark mentioned neoliberalism and self-responsibility, this increasing focus on people to take care of their own bodies and their health, promote their own health without too much state intervention or support. But also interestingly from a digital tech perspective, what the affordances are of the digital media and devices that people are engaging with, that means what they offer to people, what they allow people to do, the things that are designed into those digital media and tech, other tech. What do they allow people to do? What do they close off to people? What opportunities do they close off as well? Economic and access issues, these are incredibly important. I was recently involved in a Lancet commission. We published a report very recently about how digital health is being used across the world, particularly by young people. And of course, what we found was there were many countries where people still have very little and no access to digital technology. So there's no point even thinking about offering them digital healthcare because they just don't have the basic infrastructure, for example, something to really bear in mind. And also the digital data economy, the appropriation and repurposing of personal data. So where does all the information about ourselves go? How are they used by third parties? What are the privacy issues? There's something that's important to think about when we are using digital media and devices. So these are all the different projects that I've engaged in over the last 8 years or so. And as you can see, I've used quite a lot of different methods. That's another thing I like to do. I like to experiment with methods when I'm doing social research. So, I do use the classic surveys, focus groups, in-depth interviews and so on, but I also experiment with video ethnography. For example, I used a GoPro camera in a project on cycling self-trackers. They had a GoPro camera on their helmet. We got a video of one of their rides, and we were able to look through that video with them and talk to them about their ride, for example. I've been engaging with arts-based methods, design methods as well. For example, in the Digital Health Stakeholders workshop, I got people from lots of different kind of domains, people from the Pharmacy Guild, people from the Digital Health Agency, people who work in medicine and healthcare, nurses and midwives, and also health consumers and health consumers organisations together in one room and sort of sitting around doing interesting design-based methods, mapping the landscape of digital health, for example, and also inventing new digital health devices. So I like to experiment with those kinds of methods. I've talked to young people about their use of digital health here in Australia, but also I was involved in a big Wellcome Trust project in the UK. I've talked to teachers about how they use digital tech in their health and physical ed classes in Australia. I've done a project with a sexual health clinician about how people in the UK have used an online sexual health diagnosis service that she works at, and we just published that in Culture, Health and Sexuality journal. If you're interested in seeing what we found there. And also some COVID-related research, so how people use digital tech at home during COVID to communicate with others, do work at home, do education at home, just feel connected to other people through messaging apps. Also how they used information sources. Who did they trust when they were trying to find information about COVID, particularly in the early months when there was a lot of misinformation, a lot of confusion. And also a project about psychologists' experience of offering telepsychology. So it's actually from the healthcare provider's perspective there about having to suddenly go online to do their counselling services in situations where they may never have had to use an online format. So there was a big learning experience for them. So what I'm going to do now is I'm just going to do a sort of meta-analysis of the major, across all these different studies, the major findings. So in terms of the benefits of digital health, across all these studies, what did I find? Well, finding information instantly is something that people really appreciate. Everyone Googles, they often self-triage. So if they're experiencing symptoms, or if they're a caregiver, or they have children, or caring for an elderly parent, they will often do it on their behalf as well. They will go and Google symptoms and work out whether they need to get medical help. People appreciate better knowledge and awareness of their body and their health from going online and sharing information on social media, for example. They like feeling more in control of their bodies and their health by using, for example, self-care, digital technologies or self-tracking technologies. They enjoy improving their fitness, health and well-being. People love all the bells and whistles that they get from getting their 10,000 steps and so on. That can be really motivating. They like better access to healthcare services when they're offered online. It means they have fewer doctor visits and all that involves the expense, having to drag along their kids sometimes, taking time off work. If they can find an online service or online information that reduces that, they really appreciate that. As I mentioned, feeling motivated or reminded that they needed to do something, or they needed to get more steps. They're self-tracking. They enjoy sharing information, and they enjoy the social connections to others and the peer support that they can get online, particularly in social media or in those kinds of fitness tracking websites like Strava. And it often makes them feel less alone. And it's something that young people talked a lot when they talked about struggling with their mental health. They could go onto YouTube and where other young people were talking about their experiences of mental health issues, and just feel as if they could really relate to those young people's experiences, and they often use that term, that made me feel less alone, which I think is a really important insight. But also people do enjoy, in some circumstances, anonymity, and that particularly came up with the people who use the online sexual health service, because as you know, going along and actually seeing a sexual health clinician can be a very confronting experience when you have to have your genitals checked out. But this service actually offered a service where people took photos of their genitals and sent it through to clinicians for diagnosis. So they actually appreciated that anonymity. In terms of drawbacks, which of course there are drawbacks as well as benefits of digital health to bear in mind. So obviously the information overload, we all know just how much information can be available when we Google, and can be very difficult for people to negotiate a lot of information. Most people are pretty savvy about knowing which sources to trust. But if you're still concerned about something after you Googled it, people will often say, I just need to go to the doctor so that at least the doctor can help me make sense of it. So they do absolutely still seek expert medical advice when they're feeling confused or feeling as if they can't really work out what the information online is telling them. There's digital inequalities I mentioned earlier. In Australia, we still have problems with Wi-Fi access, with phone data access, with just sheer poverty. That means people can't get the access that they need to digital devices and media. Poor design of devices and software came up. So people living with particular disabilities or people who had just had a baby found that self-tracking apps didn't work quite so well for them because they didn't sort of acknowledge that someone might be dealing with a health issue or an injury or a disability, or with a very small baby who is actually, making them have very poor sleep and eating habits and exercise habits. Poor quality of data. People don't always get what they want from apps, for example, self-tracking apps. Personal data privacy and security. Interestingly enough, most people I speak to aren't really worried about that. But for those people who are interested in how third parties use personal health data, that is absolutely an issue of concern. And we still have quite a few breaches and exploitations of people's data happening a lot in Australia. Loss of face-to-face support and expertise. So sometimes people really do want to be able to go and see an actual in-person, person in person, and just have that, the kind of emotional support they feel they can get, or the kind of diagnosis they feel they can get when they see a healthcare provider in person. Invisible labour, sometimes it can just be too much like hard work to care for your own health at home. If you've got a chronic illness, for example. Over-reliance on self-help and self-responsibility can be, you can see that apps often focus on that. And so if that means that more and more the government and healthcare services are expecting that from people, that can be very unfair if people don't have the social and economic resources to support that, which gets on to the loss of focus on social determinants of health and social justice issues. And finally, it's important to acknowledge the more than digital dimensions. So the connections that people have with other humans face to face, which includes their family members, friends, as well as healthcare providers. They still really want and need those kinds of interactions with people to support their health and well-being. Non-human animals, we were talking about them at the beginning when we were chatting, very important. I found with my COVID-related research that people's pets were really vital during periods of lockdown to support their mental health and make them have a connection to a warm body that they could cuddle and pat and just have interactions with. And therapeutic spaces and places, green and blue spaces, for example, really important in people's well-being, which gets well away from what digital health technologies can offer. And we need to make sure that those are also emphasised when we're thinking about people, supporting people's health and well-being. And actually, this is the very final slide, but I know I need to finish now. So I'll just leave you with this. So what I'm interested in exploring from here is online therapeutic relationships, how to understand care. I'm actually running a panel on care and automation at our Centre of Excellence Symposium in July. So that's something I really want to explore more. Negotiating trust, information sources and so on. New and emergent platforms for healthcare delivery. We need to keep an eye on new forms of peer connections and sharing, e.g. TikTok, and creative and arts-based approaches and exhibitions for research, translation and engagement is something that I'm exploring with as well in future research. Thank you very much.